I'm Jody Tropiano, Health's Head of Content, here with another announcement spotlight. Today, I'm with Sy Yella, COO of DeliverHealth, who has some exciting news to share with us today. Thanks for being here, Sy.
Yeah, thank you, Jody. Nice meeting you, and look forward to having the conversation today about some of the things that what we are doing at DeliverHealth and how they are going to shape and help transform the healthcare journeys at this point.
Yeah, so let's get into it. First, can you tell me a little bit about how the provider-vendor relationship is changing?
Yeah, it's a very good question. Healthcare or providers have, this is not the first transition that they're going through. We had previously the meaningful use. Now, where they are is about transition of changes from the operations context and also from the business context. The models are evolving, and the models that they have an existing relationship with the partner, with the vendors, needs to evolve. If not, they'll be left behind, or for that matter, the businesses will be at trouble. So it's a very crucial stage on how we can transform the healthcare systems into a new operating and business model.
Great. And at a time now where health systems are really overrun by point solutions, how are you helping guide clients through that?
There's a very interesting perspective. Point solutions are actually super important. They are the key engines for innovation, right? The large systems and large solutions are slow to move. But where the small point solutions are laser focused on solving very narrow problem, and they accomplish using advanced methods. So take, for example, scheduling an appointment. That's a point solution, but that disrupted how people take an appointment. Patient payments, small thing, how we pay to the health system, changed the whole perspective. So point solutions are important, but when you have 50 point solutions, then it becomes a problem. So what DeliverHealth is doing is, how can we simplify? End of the day, point solutions are to transform operations, transform business models, and we are helping them to simplify the transformation using a package of solution that a customer, in this case providers, can configure what works for them. So that's the journey that we are helping with our customers to bring the best-in-class innovative solutions through a well-balanced administrative scenario.
Great. And taking it back a little bit, so what should providers really be looking for when they're choosing a vendor partnership? And is there a telltale sign of a successful partnership ahead?
Absolutely. Traditionally, in healthcare, the vendor management is all about how can we get the lowest price for a service or a software, right? It's a price-sensitive scenario. But now, given the challenges of transformation to a new business scenario or a digital scenario, you need to think more from a strategic partnership. And it's very different. For example, a customer's journey or a provider's journey will be very unique based on where they are, the size of the organization, and the market they are operating on. So the relationship is not anymore who's the lowest priced vendor, but who's the right partner to help transform into the journey that they are taking towards. So in this case, the partnership is about, number one, obviously, you need to have credibility. It means that you have been there, done that scenario. The second thing is, it's not about what a vendor can do. Its question is what the provider wants. So it's the listening and understanding their individual journeys and then providing a meaningful package for them to go through a journey. That's the true partnership that will help evolve this relationship from vendor to a strategic partner.
Excellent. And I know DeliverHealth, one of your main goals is to simplify the complexities in healthcare. That's a big goal. So if you can just walk us through when and how you can begin to tackle that.
That's a great question. The simplification is by far the most, Apple called it simplicity is the ultimate sophistication, right? So it's easy to say that, but it's incredibly complicated to really build it out to simple solutions. So we have looked from 3 dimensions. Number 1 dimension is how can we simplify the life of a physician? Right? They love taking care of patients. And how can we simplify all the documentation they need to do to serve the patient? And that's where we are helping them to provide them options. Whatever the options they want, we can provide so that they can deliver better care without having a bad quality of life. Similarly, in the provider case, there is tremendous complexity in the revenue cycle. The number of codes, the number of decisions, number of denials, and the various scenarios of all of them creates complexity. How can we are creating an integrated revenue cycle platform that takes the documentation, codify it, and also send it as a bill using advanced technologies so that we can simplify the workflow using our software and services. The last but not the least, which is the most important aspect, is the patient. And here, patient, like I mentioned early on, some of the unique scenarios, whether it's taking an appointment or making a payment or looking the last lab results, how can we eliminate the friction between the patient and provider? And that's where we have an amazing software with what we call it as Gemini, which takes away the friction between the patient and the provider setting. So these are some of the areas. We are not trying to solve the entire healthcare problem. We are focusing on 3 important problems related to the physician, revenue cycle, and the patient friction. And we are trying to simplify in those scenarios where we believe will have the highest impact in terms of outcomes.
Well, you covered a lot of great points today, but just one final question for you. What does the future of vendor-provider partnerships really look like?
Recently, one of our, we spoke to a customer. We asked a very simple question. What would you look from a vendor? I asked that question, what would you look from a vendor? His response was, don't come with, we have this or that. Listen and provide expertise in our journey. So if I simplify, the partnership is all about empathy, listening and understanding, and having a deep expertise to solve their important problems or journey.
It's a great way to end it. And I think that's a good lesson for many areas of life. I appreciate you for taking the time today, Sy. Thanks so much for joining us.
Yep. Thank you, Jody. Thanks, everyone.